You are welcome to our second session. Today we are looking at the preterm infant. When we talk about the preterm infant, it's important that you note that it is one of the babies that is very important in terms of the categories of the high-risk unit, because it accounts for the largest number of high-risk neonates you come into contact with, and it accounts for a lot of the neonates that are admitted to the neonatal intensive care units. And also, we'll also look at the risk factors, the characteristics, the common problems, and the therapeutic management. So our objectives is that by the end of this session, you will be able to define who a preterm or premature infant is based on the gestational age, the characteristics of the premature baby, the common problems of the premature baby, and demonstrate some proficiency in physical assessments of the premature or the newborn, and describe the therapeutic management. So for you to be able to demonstrate this physical assessment in terms of, you have to go on Sakai and view the video on physical assessment and make time to practice. For today, the key topics we'll be looking at is the premature infant, the risk factors, characteristics, common problems, and therapeutic management. Once again, you are to look at the chapter 9 of the Wong's Essential Pediatrics for Nurses, and then Fraser and Cooper, who have authored the book Miles Textbook for Midwife. If you look at this textbook, you have a lot of information on the premature infant. So to start with, this is a picture of a premature infant. And as we already said, the baby born before 37 completed weeks. So under 37, so 20 to 36 and below are considered premature. And it's also very, very important that you note that the major problems of premature infants vary. And also you have to note that the degree of maturity or survival improves as the gestational age and the weight improves. Some characteristics of the premature infant, I guess you already know, but these ones you can just read through and establish them. But in caring for the premature infant, the question is, what is our aim? Our aim is to establish that the baby breathes at birth, prevent heat loss, because this, when happens, hypothermia will worsen the newborn's or the premature infant's condition, and also clear the airway of any secretions. And also it's very, very important that the baby is born in a facility that is well equipped, and the staffs are prepared to resuscitate this newborn by drying it of any amniotic fluid, and then also suctioning the airway, providing warmth to resuscitate this baby at birth. By way of emphasis, I want to stress that we have to assess the ABGA score at first minute, and when it is more than 7, it indicates that there is no need for any active resuscitation. But when it is between 4 to 6, it connotes moderate asphyxia, and the baby may need resuscitation. It's also very important that we note that the premature infant needs support, because most of the organs are premature or not properly developed. For our nursing management, what is our plan? We have to admit the newborn and have some lab requisitions that are ordered, and this baby may need some antibiotic therapy, and then there is a need to also assist by attaching the ECG LEDs, especially in the neonatal intensive care units where these newborns are cared for, and also ensure that the baby is monitored and given some oxygen. And also it's important that we keep the baby warm and also ensure that we feed the baby and take all measures that will prevent infection, especially hand washing, and also making sure that people who have infection do not come into contact with these premature infants, and also make sure that we support the baby by giving it all the supportive care, oxygen and all that it needs. And then when the baby shows improvement in terms of feeding and then some strength and is ready to go home, we have to ensure that the family are prepared in terms of preparing the parents with the adequate knowledge to care, and also prepare adequately in their homes before we send the baby. So for the purpose of evaluation, we must also evaluate our care intermittently to make sure that what we seek to achieve is what is done. And also physiological challenges of the preterm has to do with the respiration. Why? Because the preterm infant has inadequate surfactant, the substance in the lungs that helps it to breathe. So there may be the need to support this newborn such that it establishes a respiratory rate between 40 to 60. And also we have to give some support when we see that it has these signs of difficulty. It may be in the form of larynx, retraction, grunting respiration. What is required is to give humidified oxygen by cannula, or what we call continuous positive pressure. That is done at the intensive care units. And if you happen to visit some of the neonatal intensive care units, you see some of these being done. Also, it's also very important that we position the baby on the side or prone position so that any secretions in the mouth does not choke it. And then we also suction the baby as and when we think is necessary. It's also very important that we monitor the vital signs and make sure that the baby does not go into hypothermia. Why? Because the baby, the premature infant has a large body surface compared to the mass of the body, and also has low subcutaneous fat, and also has very permeable skin that predisposes it to losing heat to the environment. So it predisposes the newborn to hypothermia. Also, it's very, very important that we prevent heat loss by also supporting the newborn by giving it warm clothing, and also encouraging the mother to carry the baby if the condition allows it, closing doors, putting on the fans, and then also putting off air conditions if they are used in the unit. It's also very, very important that we note that such a newborn may be needed to be cared for in the incubator, which provide the warmth. And also some problems that the newborn, common problems of the newborn is dehydration. How will you know that the baby is dehydrated? When the baby passes less urine, and then the specific gravity of the urine is less than 10,020, and then you also see that the skin tegel is lost. That will all tell you that the baby is getting dehydrated. And then when we give IV fluids, we also must be careful of overhydration. And here I have a few of the things that will inform you, including urinary output more than 5 ml per kilogram per hour. That is one key thing that will tell you, or on examination you see that the fontanelles are bulging or the baby is having difficulty in breathing. All these things, we have to take them into consideration when we are caring for the newborn. Another thing we have to note as I've said, is that the skin of the newborn, the preterm infant, is fragile. So it's very, very important that we don't use harsh substances like medicated soap and Preterm iodine, because it can cause burns. And then the antiseptics we use in caring, we have to dilute them appropriately. Also, another key thing we will talk about now is the problem of infection. The baby is predisposed to infection, which can come from the mother, because the baby the immunity is very low. So it's very, very important that, and then also because we do a lot of invasive procedures on them, like the labs, passing IV lines and all add up to predisposing them to infection. And the prolonged stay in hospital can also predispose them to infection. So we have to note certain behavioral changes that will inform us that the baby is having infection. So the color changes, the baby becomes cyanotic, and then also when the baby has hypothermia, or can also become extremely hot. So it's not always the case that when you have infection in the preterm or in the newborn, it will result in hypothermia, but hypothermia may also be a sign. So the skin will be cool and clammy, the baby will not feed well, the baby may be jaundiced. So when it comes to our nursing intervention for the prevention of infection, we have to make sure that we keep the skin intact, we wash our hands appropriately, we also reduce the amount of people who come into contact with the newborn. And then these days, we have people wearing artificial nails. It may harbor some infection, and such people should not handle the premature infant. And then we have some challenges. You have sometimes go to the neonatal intensive care, and you have more than 2 or 3 babies in one incubator. It can be a source of infection. So as much as possible, if the baby's condition allows it, then you may like to encourage the mother to do kangaroo mother care. Another thing to note is that the baby is also predisposed to pain, because we pass a lot of IV lines and do other invasive procedures. So it's very, very important that we give the newborn some sucrose. These are nursing measures that we can do, or some pain medication, or wrap the baby up warmly to conserve some energy. Also important to note that because the baby is preterm, the stomach is also very small and therefore has small capacity, and also predisposed to swallowing a lot of air and maybe vomiting. All these things can affect the digestion. So it's very, very important that before feeding, we assess by drawing the amount and making sure that the baby is tolerating the feeds. If not, the baby may not have to have full strength meals, but if the manufacturer's instruction says that it should be given, let's say, 30 meals per level scoop, or when we are giving the best feed for the baby is breast milk, so we try to give the baby breast milk. But in the absence of that, if the mother is sick and we are giving the artificial feeds, then sometimes we may have to give half strength so that the newborn can tolerate it. Thank you. I'll leave you to also go through some of the slides and then discuss. And also note that we have to facilitate parental attachment. And also in caring for the newborn, it is also very important that you take note and go on Sakai and view the video on the assessment of the newborn, and also try your hands on some of the assignments I have put there. Thank you.